Hello, my name is Joanna, and my social topic is the mental and physical well-being of undocumented migrant workers and immigrants and anyone considered non-citizens of the United States. I also later narrowed this topic down to migrant workers that are considered non-citizens. The importance of this topic is that there is much debate surrounding healthcare for undocumented immigrants or the possible lack thereof in the United States. A bit of historical context for this group is that migrant workers originally became a part of the U.S. agricultural industry after the Civil War and the freeing of slaves. Over the decades until present, legislation had been passed for and against the passage of immigrants into the country, usually based on the labor needs of the time. Some events that contributed to this were the labor shortage that occurred during World War I and World War II, the economic crash that caused the Great Depression, and the economic boom that followed World War II. Because of the instability in sentiments towards undocumented immigrants and the need for them when it comes to labor over the decades, there are many arguments that this population had been left to be vulnerable to health risks because of this instability. One perspective that I came across was that migrant workers and undocumented immigrants create a burden on our social and medical services due to the fact that they have little to no health insurance. Another perspective is that this burden placed by immigrants and non-citizens is not disproportionately any higher than the burdens caused by American citizens themselves. The first resource I'm bringing up is an article titled, "Why Should We Care for the Undocumented?" This is a piece written by Ron J. Anderson and published in the Journal of Ethics for the American Medical Association. I believe Anderson thought critically in his argument by seeking out and analyzing laws that provided resources to hospitals that feel a burden. He also reviewed the Medical Code of Ethics and uses this to claim that undocumented immigrants should be assisted in line with this code of ethics. He does apply his own values to this paper, such as his own Christian beliefs and how they promote assisting non-citizens, which did bring bias into this. And because of this, this part of this article is not rooted in evidence. A second resource that I had analyzed was the article, Hospitals Feeling Strain from Illegal Immigrants. The author of this article is Dana Kennedy, and the article is published in the New York Times. I believe Kennedy objectively presented both sides of the arguments, which is for and against whether hospitals should require extensive medical care to non-citizen patients and who have no means to pay for the treatment. Kennedy includes quotes from hospital administrators that give some personal insight into what the situation is, but then also included less biased sources to further the argument that the current system of treating non-citizens is financially burdensome on hospitals. She presented data from government agencies such as the Immigrant and Naturalization Service and the National Association of Counties, and was careful not to add her own opinions into the article separate from the information that was presented. The last resource that I wanted to present is a journal article titled "Historical and Contemporary Factors Contributing to the Plight of Migrant Workers in the United States." This is published in Volume 5 of the Journal of Social Medicine, and the writers of this article are Safina Qureshi and Martin Donahoe. They do not provide multiple sides of the argument, but rather provide a multitude of sources to support their claim of this plight of migrant workers in the United States. The sources they use seem to be very credible journals. And Qureshi and Donahoe also did not add their own opinions separate from the information that they were supporting, that supported their conclusions. The conclusion that I had come to myself is that there are certain health risks that migrant workers are disproportionately vulnerable to, and the current system of healthcare is one significant contributing factor. The route in which a new healthcare system is implemented is complicated and takes into account the medical code of ethics, profit, and also fiscal loss, and other factors as well. I had come to this conclusion by analyzing the information I had been given and focusing more on statistical data rather than personal statements, while taking those statements into account when weighing evidence. My own, what I found to be important when it came to critical thinking was needing to weed out emotional arguments and also arguments rooted in bias. And it was also helpful. Critical thinking was also helpful when it came to keeping my own bias out of the issue as someone who is Latina and also have family and friends who belong to this population of non-citizens. Further analysis would most likely look like exploring the directions our healthcare system could take in implementing an inexpensive and effective healthcare plan for non-citizens. Thank you very much.